You get called into your patient's room, and as soon as you walk in, your patient starts yelling at you. He calls you stupid, idiot, and a few words that I would not repeat here. And although you've gone out of your way to accommodate him, his verbal assaults are getting worse. Has anything like this ever happened to you? On this episode of Coffee and Conversations about Nurse Bullying, I'll share 3 ways to stop an abusive patient. Hi, I'm Dr. Renee Thompson, the CEO of the Healthy Workforce Institute. Welcome to Coffee and Conversations about Nurse Bullying. Look, I know, difficult patients are almost a guarantee in healthcare. I mean, after all, think about when you're sick with a cold or a flu. I mean, how pleasant are you? I've always said that working with the public can be difficult, but imagine working with the sick public, and that's what we do. However, being cranky or testy, like my dad says, is understandable. Being abusive is not. And although we are in the caring industry, it's not okay to be treated with cruelty from the very people whom we're caring for. We know that illness has a way of bringing out the worst in people. Therefore, we should be proactive and set boundaries before it's actually necessary to do so. So take the time to decide what you're willing to tolerate in difficult patient-family situations and what you're absolutely not willing to put up with. Doing so will enable you to take action at the first sign of a problem instead of waiting for the problem to escalate beyond your control. So here are just a few powerful scripts that can help you stop an abusive patient. You can say, I feel threatened by, and then describe what action that person did. I'm asking you to stop that behavior because it's inappropriate and I feel unsafe. You can say something like, the comment you just made, and swearing, profanity, whatever, is completely inappropriate and I'm asking you to stop. So very similar, but just a little bit of a twist. And here's my favorite. Mr. Rossi, I am willing to fill in the blank. Listen to your concerns, care for you, answer your questions, as long as you are willing to be respectful to me. Setting boundaries not only establishes what you will tolerate and what you won't tolerate, but also establishes a baseline for acceptable behavior moving forward. Remember, most patients and their families are misbehaving because of the situation that they're in and not because of anything you've done. So, I always say, don't take it personally, but it's hard not to. And as you know, some patients are also not mentally healthy. However, as nurses, it's not an excuse to abuse us. So are there any tactics that you use? If so, please post them in the comment section below. I'd love for you to share. And if you like this video, make sure you subscribe and share it with other people. And if you want to learn even more about how you can cultivate a more professional, supportive, kind workforce in your department, check out my website, www.healthyworkforceinstitute.com. So until our next conversation, be kind, take care, and stay connected.